Jill, thank you so much for being on the show today. And I really loved learning a little bit about your story, but only through what you wrote to me. So I wanted to hear how the story came about because you struggled with health, and that played a huge role in the formation of Rowe Casa. So what did you do to heal yourself? Go into that struggle a little bit. What you did to heal yourself and how that led to Rowe Casa's formation.
Okay. Well, let me first start by saying I didn't intend on starting a business when Rowe Casa came about. I was actually a speech therapist for 15 years, worked with children. I had a tutoring company. Working with kids was my jam. Um, but I also liked being healthy, and I wasn't, and my family was sick all the time. And then I would go to the daycares and work with children and notice they were sick all the time. And it kind of hit me hard. I was like, there's a problem here, and I realized I couldn't really help kids if they weren't healthy. It was really hard. If they didn't feel well, they didn't want to learn anything, they didn't
Hmm.
feel good. So I began, that's kind of what started my journey. I came home, it started. I had heard a lot about elderberry syrup, and I made a jar in my kitchen, and I was amused that my homemade recipe, what happened is I went to my health food store to grab some elderberry syrup, but I had learned enough about ingredients and things to be able to look at the back of the label and say, "Hey, I don't like what's in this. Why are they selling this here?" Artificial flavors and things like that I was not pleased with, all of the added sugars, and so I said, "I'm just gonna make it myself." So that's what I did. I went home, made some. I was amused that the recipe made so many jars, and I'm a Facebook fanatic, so I posted it on Facebook, told everybody how cool it was and that I had a few jars left. And slowly but surely, people started buying it from me because I was like, well, I'm going to keep making it. Then I realized just how much it was helping my family. At the time, I had 3 kids, husband, and we all started taking it, and all of a sudden our allergies and sinus issues started disappearing, and I was like, wow, there's something to this. So I kept telling people, and that's where it started. Before I knew it, I had pickup times after work where people in my community would line up in my driveway for their jar of elderberry. And
Hmm.
they would drive up with their $20 bills hanging out the window. And I said, there's no telling what my neighbors think at this point, you know? And so I would be running out my jar of elderberry to them, and made lots of new friends in the community. It's just a super fun side gig, is what it was. And from there, I realized that I was onto something, that my health just from one product had drastically improved, that I wanted to know more, learn more, and I'm kind of a research nerd behind closed doors. So I started researching the met every night when the kids would go to bed. I would be up just researching and looking at ingredients. And slowly but surely, I started making lots of other products for myself that I just felt better about. I said, I want to know what's in it. This has gotten way too relaxed.
Right.
Is what's allowed in our products and in our food and our supplements and all the things I was just not okay with. And so I'm kind of an all or none girl. So I went all in and started making some products, and people, again, they were already buying the elderberry from me. So then if they heard that I had a hair growth spritz, well, they wanted some of that too, and it just kind of escalated from there. But of course, this was only a couple of years ago. And so last year I was pregnant, and got diagnosed with breast cancer all at
Mm.
once. Because I've told everyone, you can't undo 35 years, 38
Mhm.
years of poor choices and not knowing in a year or two. So it's taken some time for me to undo all the I didn't know anything. I grew up thinking that having a whole medicine cabinet of pharmaceutical drugs was normal. This
Mm.
was normal life. And I can even remember as a kid watching that play out with my parents, thinking that doesn't feel right. Like that you would have to depend. What happens if you don't get that medicine? Do you just die? Like I was like, well, I mean, it just something didn't resonate with me. And so from there, I started connecting the pieces to, hey, something's gotten off. We have become so dependent on pharmaceutical drugs that we have forgotten what true health is. And so from there on, I was on a mission. And the breast cancer showing up, honestly, was just another wake up call for me
Mm.
to take it to the next level. I was really good at that point at making products and switches in my home with help, my personal care products and things. But my eating habits needed to change, my stress habits, I needed to begin to look at the whole body and treat that together, not, changing out your products and making sure you're getting rid of all the toxic chemicals was only
Hmm.
one piece to the entire puzzle. And I knew then that if I was going to take my business and my family's health to the next level, then this was what was required. And so since last year, I'm just almost a different person, to be
Mm.
honest. So I look back and I thank God for that because I needed that. If I was going to continue to move forward and be able to help people, I needed to take it to the next level. And so that's what the cancer word did for me. I was blessed that surgery was about my biggest part of my cure. But as we all know, post cancer is so important to continue to stay healthy, treat your whole body, stress management, getting out in nature, all the things that treat us head to toe. It's not just about, switching and ditching, our products. So, anyway, it's just been a huge learning curve for me. And I've been able to be, I guess, fortunate enough to take so many people along with us. So, that's pretty much the essence of it all.
It's a great story, and it really reminds me of many others. Of course, it's your own story. It's very personal, but it is this sort of understanding of seeing something's wrong and something actually happened that was wrong. You had
Right,
cancer, other people's have neurological disease or chronic illness. These
right.
are all warning signs, basically, of the body that something is wrong and to take action. And
Absolutely.
it's incredible that you started with elderberry, an amazing immune boosting
Right.
product, which I'd love to get into more because I know you guys do focus somewhat. You have so many products, but a lot are based on the immune system. And I think that's where
Yes,
a lot of people need to start right now because we have
absolutely.
very weak immune systems. But how important was it for you to be doing that research and educating yourself? And why do you think that many people don't do it? Because I hear that story of yours and I say that makes sense. You had a problem, you researched it, you questioned what led to that problem, such as pharmaceuticals not eating right, and then you
Right.
changed it. But a large portion of the population just keeps going and adds more pills, more
Yes.
toxicity, and gets further
Yes.
away from nature. So what was it, in your mind? Is there anything there that you could even share that led you to do the research and to start making your own elderberry that maybe someone else can say, I should do that too?
Oh man, I think because I began to question the system, I think
Yeah.
so many put their trust in a system that just is failing us.
Mm,
And I guess I'm thankful that I was able to realize from an early age that something was wrong. I wasn't sure exactly what that was, but just the health changes that came alive when I just started just simple elderberry. I mean,
right.
one little change and watching my family's health transform, I was like, whoa, what would happen if I made more healthy changes? Like, this is pretty amazing. So I think, we've trusted a system for a very long time that does not work. It's a system that I want and I'm thankful for if I need a major surgery, if I have a broken bone, but it is not a system that I want to place my trust in to stay well and be well. I think that we have forgotten to merge. We've got the Western medicine that is strong here in the United States, but we have forgotten all of the benefits that Eastern medicine has to offer us. And we need to begin to merge the two. Is our whole intention and goal. It's not to, bash doctors or to bash our medical system. It's to put everything in its place. We have failed to do that. And
Yeah.
so I hope that, that's our goal is to help people start to think for themselves. I want people to realize they have a brain. And
Mm,
my own oncologist told me that when I was making decisions post cancer. He said, you have a brain, you should use it. You don't have to take the conventional route. I said, well, I don't plan on it. So thank
yeah.
you. But, that's what we need to be telling people more of. That's where it begins is, hey, you know what? I can read that label. I can decide if I should use my money and buy that product. I want people to begin to think for themselves. They're smart. We were given a brain to use, and there's smart people out there. I want them to realize they have the power to be the change.
For sure. And this is something, again, I've heard from many doctors and experts and other people as well, especially during this time we're in a pandemic, we're all sort of fearful, is this idea of thinking for yourself, and not allowing. I was talking to Dr. Palevsky, who's very vocal on vaccinations and and child's health. And he said, we're in a spot where it's not even we're being told what to think. We're just not thinking. We're just,
Right.
just seeing something and that's the truth and not even comprehending, not using it. And when
Right.
you don't use it, you lose it in a sense. And I think
Exactly.
what he said, you lose a lot of intuition too. And I heard that when you said, I didn't know what it
Mhm.
was, but I knew it wasn't right. I knew I needed a
Yes.
different way. That's intuition. We all have it, but we lose it if we don't use our brain, we don't use that
Absolutely.
connection to nature and the universe. So, it's really great for people like you to share that because others can then say, I want to tune into that and also see maybe I should go
Yes.
that route. And so much of it again is research, but experience. And
Yes.
you
Yes.
experience elderberry, something simple,
Yes. Simple.
and it
Mhm.
had such a shift for you. And that's what I wish more people did, was not just knock something and say, oh, it's not scientific, or it's not a
Right.
drug. Say,
Right.
try it and see and experience and go into it with an open mind. But one of the
Yes.
things that I find is difficult, even if you want to try it, is to understand what is truly natural, because you see that tag on so much right now.
Oh, yes. It's a
Organic,
sales fad.
natural,
Yes.
right? They are marketing tags. These are huge companies that have
Yes.
nothing
Very
to do,
deceiving.
right?
Very deceiving.
And I wanted to hear, what Rowe Casa kind of sees as all natural, and what steps do you take to really ensure it is natural and not
Right. Great
processed?
question. Hey, that's a great question because that was my concern as I went to my health food store. I knew where to go, I thought, to find something natural, right? I
Yeah.
picked it up and it was not natural. I was like, what's going on here? We are so committed. I mean, we start with our water supply, making sure it's filtered correctly. Elderberry, if you're making elderberry with water with arsenic, you're not doing anyone a lot of good.
Right.
So, filtering our water from the get go, making sure wherever we order from is organic, all of non-GMO. I mean, I'm looking for those labels for that, all of those things. I know that that's not often perfect, but it's better. And so, I don't compromise. For a while, I had a few products I was adding aloe vera to until I realized you can't have aloe vera without a preservative. Most people don't realize that, but the minute I noticed it, I said, take it out. We're going to print new labels. We're going to change this product. I mean, if unless you're using aloe vera straight from the plant, you're not using it without a preservative, and I'm not going to put a preservative that's harmful on my label. So again, we found, other ingredients that we could do without a preservative, and people are like, aloe vera, that's natural, right? Well, yes, if you're getting it from your plant,
Yeah.
evidently, because when they send it to me, it's going to have a preservative or it has to be refrigerated, and that's just not going to work. People aren't going to be able to keep their stuff refrigerated if we're shipping it and things. So I have to think about that. I tell everyone not all ingredients with the same name are created equal. Our vitamin C, ascorbic acid, that is used in our syrups, is from lemons, but because it's non-GMO, and you can put vitamin C on your label, and it can come from black mold. That's
Hmm.
not okay. But it's made in a lab. Us humans decided we could do it better, and a lot of you have natural products with vitamin C in it, and people are deceived because that's all that has to go on the label. So I try to educate our customers on that. That's really important. I don't want black mold in my stuff. I just don't. So, making sure that everything is sourced from the right place because it is hard navigating all of the deceit out there. I mean, it's a free for all out there. That is a scary place to be because you can think you're getting something natural and you're actually getting something that's harming you. And that's why we exist. Is I was not okay with that. I was not okay with that. And, you know,
It's an
it's
interesting industry, isn't it? Because I've been in the supplement industry both as a distributor and in the last few years turning into more of that manufacturer and navigated that. And it is a little like the wild, wild west because you have products just
yes,
coming from China that are completely tainted and getting into,
right,
smart people's hands who are trying to make healthy choices and actually
right,
poisoning themselves.
right,
And then you have really good companies that kind of go unnoticed because the big ones have huge marketing campaigns.
right.
They have
Yes,
sponsors and
yes,
celebrities talking about
yes,
it. And if you looked
yes.
into it, half of it is black mold, preservatives, heavy
Mhm.
metals in it. And no one really
Yes,
questions that too much. That's why I think
right.
the stories are so important to tell.
You're right, you're right.
Actually opening up and being transparent and saying, this is how we do it. We know that aloe vera has preserved. So we said no. Whereas you're going to see aloe vera as a kind of marketing ploy to say, ooh, it has aloe
Absolutely.
vera and it's
Yeah,
great
sounds
for
so
you.
natural.
But I didn't know that personally. I never worked with an aloe vera product, but that's fascinating to me. And you do learn this a lot. And that's why it's really
Yes.
important to hear the stories of people who have gone through it. So that's
Yes.
amazing you're doing that.
It's little things like that. When we started out, I had the elderberry syrup. I created the tart cherry syrup for sleep. And of course, it has tons of other benefits. But when we started with our syrups, that was our big seller. And of course, it became a business quickly. It blew up very fast. And we had stores locally that wanted to carry the products. And we would buy them coolers and we would store our syrups in coolers because I told them, I said, unless I can find a way to create these syrups without a harmful preservative, everybody's just going to have to keep them cool. And so,
Yep.
it's at this point, we were still a local company and we were actually able to hire a food scientist who taught us how to jar correctly with the right temperature and all the things. So we've got a whole process that we do. And of course, the vitamin C, making sure that that's a pure form from lemons, non-GMO. That made us shelf stable. But I forever people were like, we need, everyone wants convenience. And that was where I drew the line. I said, I know it's inconvenient for you to have to keep it cold and take it home and get it in the fridge. But for now, until I figure out a better solution, you're gonna get the right thing. I'm not going to sacrifice for your convenience.
I really love that because people usually ask, what are the shortcuts to health? And I say
Right.
there are none. There are
None.
no shortcuts to health. And if you think there's shortcuts to success in life, you're wrong too. It may
Exactly.
seem like someone got to $1 billion in a year, but you do
Right.
not see everything they went through. And
Right.
sometimes, going too quickly and using shortcuts to get there, it may seem like it's good, but then the problems come along later.
You
You're,
see, yeah, where it all
and
went wrong.
health and life and success are marathons, not sprints. Look at it
It's
that
true.
way and spend a little bit more time on it. I think people have that problem right now of saying whatever is convenient is quickest. I don't have
Mhm.
time for that. Do you have
Right.
time when you're sick then? Will
Right.
you?
You will have to make time. That's the thing.
Exactly. That's the big question that people aren't doing. And
Uh-huh.
that's what it's great that companies can also represent that in how they produce, like Rowe
Right.
Casa does. Do you have
Right.
any fears of scaling up? You become bigger and bigger, which is a wonderful success story.
Mhm.
Everyone wants to see that. But I know at a certain point, it becomes very hard to really scale up to millions, let's say, if not,
Right.
tens of millions of people and still keep quality at that level.
Right.
What are
Well,
your feelings on that
that
as you
can
do?
be a scary thing. We talk about that a lot because it has only been 2 years. I mean, we're in over 300 locations all over the nation now, which is amazing.
Amazing.
It has all happened super fast. My sister, that's why I have co-owners. My sister and her husband, he's like a business guru. Praise the Lord for that because I needed all the help when it came to the business side. So he runs the business side. My sister is actually who taught a lot of my health knowledge to me. So and then my husband was my shipping department for at least a year. So we've all
I
kind of
get
been in this
it.
together. And we talk about that a lot. We know we feel like this is where this is headed. We think that people in America are waking up.
Mhm.
They're tired of being sick. They're tired of trusting a system that has not worked for them. And we feel like we're getting to be a big part of that. And so we think we have that on our radar, and it's a scary thought. And we always tell people when we hire them, you're getting on the roller coaster ride, so just get ready. But we feel like, we've got some things in place that if we know that any day it could do that. It could, the Target signs up for, anybody does, something like that happens, it changes drastically. But we feel like we're in a place that where we've got so much quality control, um, so many operations in place to ensure quality. That was a really big. We said, we wanted to go big last year, but we weren't ready.
Yeah.
So we feel like this is the year almost to where we're actually getting things in place to be able to scale however big we need to do it. We want to reach as many people as we can. And so whatever that looks like, if that means new facilities all over, we're game, we're ready. We're just kind of waiting. We're in that waiting zone, and yes, it's scary, but we're excited about it.
Exciting and scary, the life of an
Yes.
entrepreneur.
Yes.
Should be the name of the book there for
You're
all
right.
entrepreneurs.
Yes.
You mentioned quality control there, and one of the questions I want to ask you, what does that actually look like, and what does the R&D process look like? Because I think these are really valuable to listeners to understand what is
Absolutely.
the process of making these that makes it so high quality, and what is the R&D, who decides and who comes up with the next product, because I think that's essential to telling the story of the end product.
Yes, that's a great question. So for starters, we had a guy come in who was his degree was in like standard operation procedures, SOPs.
Yep, SOPs, I know.
So he came in, he got us all set up within the facility. We are not FDA approved, and I will say we've been turned into every FDA agency probably in America.
Mhm.
And at this point, they just kind of laugh. They're our friends. We're not FDA approved. We don't have interest in that, but we did have an FDA consultant come out and make sure we're legal.
Yep.
So we have all the things. That was kind of one of those things that needed to be done, so
Mhm.
that we made sure all of our operations were legal and we were doing things correctly. So that's very valuable to us. She is practically on staff with us now. We just go to her for any questions, and she's been so helpful. And so now when people say, we're turning you into the FDA, we're like, well, we have someone if you'd like to talk to her. They like to use that a lot against people who do natural things. But we just, that was a scary thing when all of that started happening, but we just took it in stride and got the help we needed and made sure we got those processes started up. We have lots of eyes on every development, sign offs. We have, all kinds of operations like that to make sure it's not just a one person gig, creating. We have a team that creates, of course, I'm on that team, but we create the products. We're constantly testing them out. We have, several of us that are, okay, I like this about this one. And, we're given feedback. And then the final product is approved by all of us. So before it even touches the hands of the customers, we have probably been working on it for months. So that's just kind of how that works, and some of the ways we've gotten things in order to be able to serve bigger, I guess, if that makes sense.
No, it's not easy, and I do want to backtrack to that a little bit, what you said about being turned in and the FDA getting involved in something that is so natural, right? That you could
Mhm.
pick off a tree and take,
Right.
and you're just doing that into a syrup. And what has that been like to actually have people come after you in a sense and kind of, be negative towards that and say, we're turning you, what I don't, I've had it happen too so many
Right.
times
Okay,
that you
yeah.
almost want to say, what are we turning in here, guys? What are we really angry about? That people
Right.
are getting better with natural things? Because I know claims are
Yes.
always enforced. And yes, you can't make
Right.
a claim to treat, cure, prevent disease,
Right.
which I'm
Yes.
sure you guys know
We
and
have
don't.
had to clean that up. You're right.
Yes, over and over.
Uh-huh.
And we've gotten those FDA letters, even when actually an article we put out at the beginning of COVID, it wasn't even COVID related, it was virus and infection related, and saying elderberry is great for the immune system. Weeks
Mhm.
later, we got a letter from the
Oh,
FDA saying you
wow.
can't do that.
Of
And it was
course.
like,
I
why
mean,
can't we? I mean, there is
I
scientific
know.
literature to it. There is so
Right.
much there already. What do you think it is, Jill, that people are just so negative sometimes to something again that's so
Yes.
natural and been on earth forever, and you're just kind of helping people obtain that, making it easier for them?
That is a great question too. At first I would be mad. How
Me
dare they?
too.
It felt personal,
Oh yeah. Oh yeah.
But when I backed up and really looked at it, I realized people are still just very like, again, it's a failure to merge the two.
Yeah.
There's a place for Western medicine, but we have forgotten how to be well and stay well. Within Eastern medicine has a huge part in that. And so the merging of the two again is our goal. I think that the people over here, they trust the Western medicine so hardcore, and the science behind it, and they are still part of the system, that it's hard for them to accept there would be any other way. And so those people that are turning us in, I just always felt like, I felt sorry for them,
Mm.
because I think that, when you can open up to both and merge them, you find really amazing things. We are blessed to have some of the technological advances in our medicine here in America. But man, if you can merge the stay well, be well, with that, we're in a place to be healthier than probably we've ever been. as a society. And so I think they've just failed to really embrace that yet. And they find their hope in a system that, that hasn't really worked for many, but for them, it's a place of security. And
Yeah.
so I think that's where they come at us from.
Yeah, I've learned also to show empathy. Of course, the first
Yes.
reaction is anger and
Yeah.
upset, and
Yeah. How
you're
dare
just
you?
trying to do the best for people, and here are people trying to stop you from doing that.
Right.
And
That's how
even
it
taking the
feels.
business side out of it, that kind of hurts,
Mhm.
where you kind of put in
Mhm.
your blood, sweat, and tears to help others.
Mhm.
And at
Absolutely.
a lot of time at a loss. I'm sure you know that in the beginning, you're not making too
Oh,
much money
it's an
off of this.
investment.
Yeah,
Yes.
it's a huge investment, and that does, but you have to show sometimes that empathy for people that just are not open to it, are not aware. There has to
Right.
be their lives in a sense are in a bit closed off to certain things that can hope that would enhance it in some ways. That
Right.
would bring you back to how we lived for thousands of years,
Right.
in tune with nature and
Mhm.
not against it and relying on a chemically kind of induced way of life.
Right. Exactly.
Oh yeah, no, it's I think it's a challenge that every company in the natural sector, nutritional sector,
Mhm.
holistic sector deals with. And I think it's one that people are picking up on, that this is helpful. This is good stuff. I've experienced it. I've tried it. It helped me
Yes.
like you did.
Mhm.
And so let's go into some of those products, maybe the top two, even with I know elderberry, right?
Mhm.
Syrup is
Mhm.
one. The tart cherry syrup as well. I've tried both. Wonderful.
Oh, good.
Great. But let's talk about the benefits and how you should take them and who should take them. Because people are
Okay.
probably listening and saying, okay, what do I need elderberry for? I'm not sick right now. I don't have a cold. When would I take it? How do I take it? Let's start with the elderberry and give us a little insight on that.
Okay, well that's my jam. I love to talk about the elderberry, mostly because it's one of our top antioxidant berries on the
Mm,
earth. And so that is why it's so effective. And I've had to really look into that and why are antioxidants so important? It's because they go in, we've got these free radicals roaming around in our bodies that create disease and cancer and all things. And they're trying to form up together, and that's
mhm,
where you pop up a tumor or you'll pop up a whatever. And antioxidants, what they do is they go into the system and they grab those up and they get rid of them. And so that's why I think elderberry, to say what does it help with, well, you name it, I mean, because I believe there's only one sickness, and that's unhealthy cells, that's depleted
mm,
cells, cells that have gone rogue because they're not getting what they need. um, and so when you can put that antioxidant into your body daily, I believe you're going to win, and you're probably going to be shocked at how much it helps you. For me, it was sinus and allergies. That was my symptom of what was really going on. The root was I had some unhealthy cells and I was sick all the time. But once I took care of that, that went away. It was amazing. Um, and so elderberry is great for most people. There's a few autoimmune people who have not done well with it. Autoimmune is a very tricky thing.
mhm,
And so that's why we have our antioxidant infusion with cranberries, blueberries, and aronia berries. We created that for our autoimmune peeps. A lot of autoimmuners can take the elderberry, but you
mhm,
just have to try it. I mean, every person's different, but that's really the only people I can think of that might not do as well with elderberry. Something with their immune system, it attacks itself, like
mhm.
autoimmune's like, whew, for me. But my sister actually has it, and the antioxidant is a huge win. And so we created that with them in mind. Of course, you can't have too many antioxidants, in my opinion. So I take both. But anyway, the elderberry, I think that our elderberry is effective too because it has the cinnamon, clove, and ginger in it,
Mm,
which are great for any kind of inflammation. A lot of our sicknesses start with inflammation. With cancer, what do they check for? Inflammatory markers.
mhm.
And so, which was shocking to me. I was like, so you're telling me my inflammatory markers can tell you if my cancer is better or worse? So that tells me if I'm treating inflammation, I could also be treating cancer, maybe? Okay. So, I was starting to put that together, which no one tells you that,
Yeah,
you
yeah,
know, but that's what they look at. The conventional doctors will look at your inflammatory
mhm.
markers. And so I'm like, so why aren't we just addressing inflammation? So, elderberry that's why it's great. The ginger, the clove, ginger clove, what I say, cinnamon.
Cinnamon.
All of those things are so huge. The list of benefits to just those alone are a mile long, in addition to elderberry. So,
And it's an interesting time because you bring up sinus and allergies. It's allergy season right now. So many
yes,
people I've talked to said this is the worst allergy season.
I've heard
And
that.
there's a lot of interesting kind of hypotheses going on. Of course, there's the hygiene hypothesis that if you don't expose your immune system to things like pollen allergens,
Hmm.
different,
Hmm.
pathogens and everything, it weakens and then you could have a strong response because it's not trained. People don't realize allergies really aren't a reaction. It's not because of the pollen, it's because of your
Hmm.
immune
Immune
system's
system.
reaction to it.
Absolutely.
It's a benign
Absolutely.
substance. That's why I go
Yes.
outside and I don't get an allergic reaction. You
Right.
do. We both have immune
Yes.
system, right?
Yes. Yes.
And during the last year, we've been living with masks on. We've been living inside, not
Right.
exposing
Yeah.
ourselves,
Right.
sanitizing everything.
Hmm.
So, I've read this, talked to doctors and talked to patients as well that are saying they're having these overreactive immune system or overreactive kind of responses to
Right.
allergy season right now. And what can they do? And I think one of the things they could do is give their immune system a boost with something like
Yes.
elderberry. So simple. And
Absolutely.
people think it's Claritin, it's this. That is
Oh,
just
yeah.
subduing your immune system even more.
Yes, yes, it's gonna
That's
create
the worst thing
a
you could do.
long-term problem. It might fix it
Absolutely.
and that I lived on Zyrtec, and I felt
Yeah.
awful on it, and I didn't know there was a better way. I was the girl you could hear snipping and snorting down the hallway, and they knew it was me coming. I had the issue, and I would get it for months.
Yeah.
And it's funny you talk about the pollen. I get so sad because I even have friends, we'll walk outside and they're fearful of pollen.
Mhm,
I
mhm,
walk outside and I take a deep breath and I'm like, I'm
mm.
not scared of pollen any longer. All I know is that if my immune system is strong, my allergies and sinus issues have disappeared. So I know
Absolutely.
that.
Yeah.
And so in knowing that, I don't walk outside and I'm not fearful of allergy season,
Yeah.
and pollen season. And I'm not
We
fearful for my kids to go out in it and play in it and get all dirty in it. It just
Of
doesn't bother me.
course. We should
That's it.
never be fearful of nature, and it's been
Right.
shown time and time again, getting your hands in dirt, being outside more, even with pollen, exposing yourself to these things strengthens it.
Absolutely.
Just like you
Yes.
need to go to the gym to strengthen your
Hmm.
muscles, otherwise they go in atrophy, you just sit around and become very weak. Your immune system's
Yes.
the same way. It needs
Yes.
nature to get strong. It needs to be
Yes.
exposed.
Absolutely.
And if you're in that state where it hasn't been, it's pretty weak. One of the things you could do, just like giving protein to muscles or amino acids, is elderberry is great. So
Hmm.
I love that you brought it up because it is a solution to a lot of people's suffering right now and going through some kind of allergic reaction to
Yes.
pollen and the
Yes. It's a
seasonal
big
overnitis.
issue.
Yeah.
Absolutely.
So let's move on to tart cherry because before
Okay.
yeah, I tried this, I wasn't too aware that it was a sleep support
Mhm,
thing. I
mhm.
knew cherry also, just like many different berry, had antioxidant, had of course
Mhm,
benefits,
mhm.
just like all fruits,
Right,
vegetables have
right.
benefits. But sleep support, you think of melatonin and then you think of sleeping pills and everything.
Right.
Tell me how your tart cherry syrup works to help support better sleep.
Okay. So when we started deciding what our next syrup would be, we looked at what is the request we get most, and it is for better sleep.
Hmm.
People are not sleeping well, and that's a real problem. Now, knowing what I know, what that tells me is their melatonin is not being produced, and that is a hormone that is super important for our bodies to thrive.
Hmm.
And so, if you're not getting good sleep, it's a real issue. And so when we started reading, I said, is there a natural way we can help people? Not these people are on narcotics. They're driving to Walmart on Ambien and they don't even know it in the middle of the
Yes.
night. I mean, what is going on? We've got to help these people. I mean, I sleep hard. So this was not an issue it's why it wasn't my first syrup because I didn't have a need for better sleep. Thank goodness. But so many do. And there have been times in my life when I was stressful that I didn't sleep well. And I feel bad for people who don't sleep well. So we started researching and what can we do? My team and I were on it and we were looking at what could we do? What could we do? Tart cherry kept popping up. Tart cherry has a natural form of melatonin that equips our bodies to produce that naturally. And so that's why we love tart cherry. Of course, tart cherry helps with muscle recovery and all gout, all kinds of inflammation type things. So it's a total win. We threw in the valerian root, another great thing for just to help someone relax, the chamomile. And so we hit a huge win with that blend. It took a lot of trial and error, and I can remember making the first pot in my home just to try it and see, and I kept testing it, and I got so sleepy. I said, "Y'all, I don't know if this is just all in my head or if this is really working, but I'm super pleased. I'm like really sleepy." And so now we all laugh and say it wasn't all in your head, Jill. It really does work. It's one of our top sellers, and so many people swear by it. It takes time, though. I tell everyone with anything naturally, you can't expect it to happen overnight.
Mm,
You've got to build up your body's um, the storage in your body of all
yep.
of that, and so and start equipping your body. It'll know what to do when you're giving it what it needs. It just takes time sometimes. So time and consistency are so important when it comes to these things. We've had people say within a week they were getting better sleep. We've had some say it took a month,
Hmm.
and they were so glad they didn't give up. But I'm like, just do it. If
Yeah.
you can't sleep, just do it. Give your body what it needs. And tart cherry is one of the ways you can do that. Of course, that's what I love about natural products is you think you're taking it for sleep and all of a sudden this goes away or that goes, the things with the plants that God gave us, it just shows how amazing He is to give
Yeah.
us plants that can do 100 different things, literally.
Isn't it amazing how these nature provides so many answers, and it provides it in such a comprehensive fashion? Like you said, people like
Right.
to say see one to one. Many of the
Hmm.
doctors I
Right.
speak with are always, all right, for this symptom, what do you do? And it's
Right.
okay, you could do this. What about for this symptom? Same thing, right? It
Right.
works on the whole
Exactly.
system and it blows their mind. They're like, no, it's usually one drug to one symptom. That's what we're used
Yes.
to. But we
Yes.
forget that over 80% of the drugs we use are derived from the plants and
Mhm.
fruits and vegetables and just
Right.
synthetically made.
Exactly.
So
They
we're
all
just taking a
started
little
with what
piece,
go
right?
yeah, yeah. We took and thought we could do it better in a lab and we could do it more cheaply, and it has not worked out for us. We are
It
not better
hasn't.
than God.
No.
Hello.
No, and there is a little bit of arrogance there, I have to say, among many to say
Absolutely.
we are better, right? We
Mhm.
know that we could
Mhm.
do it better. And I think a little
Yeah.
bit also comes from the instant gratification we like to do because we do want it right away.
Mhm.
If
Yep.
I'm not sleeping right
Absolutely.
now, I want to take this pill and
Right
be
then.
out, in
Right.
5
Right.
minutes.
Right.
What
Yeah,
are
we've
the
become an
repercussions for
instant
that? Yeah.
instant society.
And that's the problem, and I hope more and more, especially as they see problems showing up more and more where we have the majority of people chronically ill, truly suffering, no real solutions that the conventional,
Mhm.
paradigm will give them except managing that disease,
Yes.
that they'll say, "We need a different approach. We need to
Right.
look at things like using instead of popping pills, going to the cherry,
Yes.
going to
Yes.
things that boost us and take time, of course, but in the long run, that pays off so much."
Oh, absolutely. Absolutely. We always say, if you have a system that is symptom medication, you don't have a healthy people, you just have a medicated people.
Oh, yeah,
You know, if we don't have a virus problem, we have an immune system problem in America.
absolutely,
And that is
absolutely.
the essence of what we're seeing play out and why we're masked and why we're scared to socialize and scared to go outside and scared of the sun when we've just been, it's time. Things have got to change.
Let me ask you, since the pandemic and COVID, have you seen a change in the customer base? Have you seen more acceptance? Have you seen just maybe even a pullback because people are fearful in keeping their money? What have you seen at Rowe Casa since this has started?
I have honestly, for us, we have seen people become even more alive
Mhm.
to wanting to be well. They are concerned. They are aware that they might have a little bit of power against this, which is that's what's so cool is when you realize the remedies right here in your garden or right here, with a natural supplement, you feel empowered. You no longer feel like, I mean, growing up, I thought, so you take medication, you try not to be sick, and then you die. That's how it felt. And I was like, that doesn't feel very empowering, right?
No.
But being able to live a life that's healthy and where you have remedies right in your backyard, that is empowering. That feels good. And so I think that's people have decided, hey, wait, this is bad. This is not good. And they have come running. So I think that's why we're crazy crazy over here at Rowe Casa, but it's because people are waking up, and it's a worldwide pandemic will
Yeah.
wake you up,
Yeah.
and that could end up being a good thing. Maybe we could make some good out of this. People will maybe start taking charge of their health. I would hope.
Yeah, it is a silver lining that I've heard everyone I've spoken with say
Mm,
that
that's
if
awesome.
there is something that comes out of this is people need to value their health more, because
Yes,
you're seeing the people that
absolutely.
suffer the most through this pandemic,
Right.
comorbidities, obesity, deficiencies of all
Yes.
this is 90 something percent of the
Right.
people who are,
Makes sense.
really
Hmm.
affected by this. And unfortunately, the majority of Americans really aren't healthy. We have to be
Absolutely.
honest with
It's
ourselves.
very true. It's
Right?
very
We
true.
gotta
The
start
system
taking
has
those
failed us.
actions. Yeah,
Hmm. You're exactly
absolutely.
right.
So tell me some more about the product because you have so many now, and that's
I
great. You
do.
started with elderberry, and it
It
just
is
went to
crazy.
so many. And I was going through and kind of selecting ones to buy. I'm like, "Ooh, this. Oh, there." And so tell us about the line, like kind of, what it encompasses so people get a better understanding that it's not just two syrups you do
Right, right.
lots of other things. There's essential oils
Exactly.
and beauty
Hmm.
products and everything. Can you give us a little bit more on the line itself?
So mainly what it is I would just, okay, for example, I wanted better lashes. I mean, just because you want to be natural and healthy doesn't mean you have to quit having fun. Okay.
No.
I wanted good natural lashes, and I looked at the going natural lash, I mean, not natural lash serum on the market. A, it was super expensive, but B, almost all of them have isopropyl propionate. Try to say that 3 times, but I've gotten good at it because I preach about it a lot. I said, wait, that's linked to eye drooping, eye issues,
Hmm.
blindness. I'm not putting that on my lashes. So I go home and I make my own. Hey, there's castor oil. Hey, there's rosemary, protects the hair follicle. That's what I want on my lashes.
Right.
And now we have a lash serum. That's how it all has kind of happened, is like, hey, I don't want to use Rogaine for hair regrowth. I'm going to create my own hair spritz, and then I like a chia pet because I've got all this new hair coming in. And obviously people want more of that. So we have a lot of personal care items. We're all about self-care, and
Mm.
we're two girls on the owner's team, and we know how important that is. And so we've got a whole personal care line. A baby line. I mean, we both have 4 kids, so 8 between the two of us. So we needed something for babies and kids. So we have a baby line, and we created products. They don't need the essential oils to be as strong as adult products. And mainly, all it is that stuff you could make at home, but you don't have the time to do, nor the time to research how much of what oil should go in the blend. And we've done all that for them. And so it just makes it easy for people to switch over and not have to do tons of research themselves, because we love to research over here. And it's hard. There's a lot of plants out there. There's a lot of essential oils, and it's hard to know what should go in what and what is safe for what. And so we're doing the hard work, putting it together for you. You don't ever want to use essential oils straight out of the jar. So, knowing how to dilute those oils to make it safe and make sure you're not overdoing it. And that's kind of what we do. We did a lot of trade shows in the beginning, and one of the biggest questions was, "Do you have dog products?" So I was
Hmm.
like, "Well, I don't, but I bet I could figure it out." So I started a dog line. So it just kind of has come from customers needing something and saying, "Hey, I bet I can find something for that." We now have a cleaning line because that is something everyone
Hmm.
uses. So just that, it's just a little bit of everything over here because we need to get rid of all the toxic stuff. That stuff, it's all bad, and it's
Yeah.
been a free for all for too long. I think Europe has outlawed over 1,000 chemicals in their products. We've outlawed 9, if that tells us anything. So it's a personal care products is a big deal. We are jacking up women's hormones. We're dealing with lots of infertility.
Yep.
Just we have a blend that balances hormones, and just from that alone, in 2 years, we're almost at 400 Rowe Casa babies that have been conceived
Wow.
just by using this blend of drops. I have my doctor, when I was pregnant, she said, "Jill, I don't know what's in those drops, but I've had women who can't get pregnant, and for years I've tried every medication there is, and they tried your drops and got pregnant." I'm like, that is the beauty of natural. That is it. That is it. And so we have now I had to hire a person just to keep up with all the babies coming in. I can remember when I first started the hormone drops, or they're called P boost drops now because they boost your progesterone.
Mm.
But, I can remember people texting me, "I got pregnant. I've been trying for 7 years, and I've been trying for 4 years, and oh my gosh, I'm pregnant." And I was like, "Where's my notepad? I need to start keeping up with all these babies coming in." So that's how that started, and now we're at, like, almost 400, I think. So we announce them constantly on our Facebook page, so it's
That
super
is
cool.
amazing. Yeah, that's really cool. And I love how you're doing it from a personal experience and customer experience rather than just marketing research, because that's where most companies come from.
Right.
They build a product off what the market kind of is showing is most profitable and what they could see would, the most people buy into at the marketing terms
Mhm.
versus what you really want. I always
Right.
said I wanted to build a company. Profits weren't first. I wanted to be something that I would be excited to open the email for, that I would
Yes,
favor and be like,
yes.
oh, great, another one, or just
Uh-huh,
something
uh-huh.
that excites me. And there was a
Right.
time where I was doing this and I was in business and I was like, this isn't exciting for me. And I
Right.
started to lose a little bit of that passion. And honestly,
Yes.
we were making a good amount of money at the time, but
Right. It doesn't
whatever.
matter. It doesn't
Right.
matter.
All the
It
marketing research in
mhm.
the world would have said, keep doing this, double
Right.
down on it. But
Right.
in reality, it didn't feel right. And I
Right.
love that about a
Mhm.
family-owned business that's doing this, that it just feels right. And you're doing things that you want to use, that you
Absolutely.
personally would use, where I
Oh,
feel like so
yes.
many companies don't do that.
I
You
don't
go
care about
into
that, yeah.
CEOs of big companies, they have different products everywhere but their
Oh,
own.
hey, when we launch a new product, you'll see us as a team. We're saying, when is this one coming? We're so ready for this one. Like, I'm like, I personally need a stain remover. We need to get on this. I mean, we're as excited as anybody about being able to create these products and use them ourselves. I mean, we love it. We do. We really love it. That's a
Well,
good point.
one of the questions that popped up when I was kind of meeting with the team beforehand, and I also asked our medical team, and one of the nurse practitioners brought up hormonal imbalances. The use of just chemicals is
Mhm.
so prevalent, and there
Oh,
was a
yes.
recent study out of San Francisco, I think, that showed in mothers who were pregnant that both the baby and the mother were showing that they had 88 chemicals that they just could not identify. That haven't yet been identified anywhere in the world by the labs. That means they're creating
Wow.
new chemicals that no one even knows about that are getting
Right.
into us, and we have no clue what they're doing. We have
Oh,
no clue.
yeah. Yeah, it's a scary thing.
And hormonal imbalance is a huge issue,
It
right
is. It
now.
is.
Tell us about how the essential oil drops that you created can help with that. You mentioned progesterone,
Mhm.
but this
Mhm.
is through a natural way where so many are,
Right.
of course, taking bioidentical hormone replacement therapy and other,
Right.
ways to do that. But I always say turn to nature first. So tell us a little
Mhm.
bit about
Mhm.
that.
So with the hormone balancing, our hormone drops P boost now, it has progesterone from wild yam, which is known to be the closest thing in nature to humans' progesterone. And so that's how it actually boosts your progesterone. Most women can't get pregnant or have a miscarriage because their progesterone levels were low. That really sang to me when we developed that, because when I was pregnant with my 14-year-old daughter, I thought I was miscarrying and they put me on a progesterone cream. I didn't even know what that was, but of course, you just do what your doctor tells you to do.
Yep.
So I used it and it saved my baby and we were good. So I thought, maybe there's something to this. So when all of this started happening, I thought, there it is. That's that progesterone. But the essential oil blend that comes with it brings balance to all of the other hormones that are involved and being able to keep you fertile, to keep you balanced. There, in my opinion, there's been a huge attack on women's health because of all of the endocrine disruptors in our products, anywhere from cleaning products to the foods and the chemicals in our foods, and then our personal care products. It has drastically disrupted our hormones, and hormones are everything,
Everything.
especially if you're a woman and
Hmm.
especially if you want to have a baby. And so many out there are struggling with that. And so the fact that there are plants and oils that you can extract from those plants that bring balance to your body is an amazing thing. My doctor, I'm postpartum, my baby is 7 months old. I had all the things last year with the breast cancer and all the things. things. And she is amazed at my labs. My hormones are low, my hormones are balanced. I mean, they're just beautiful because I know what to do to keep my hormones balanced. She even was jotting down, what's in that blend? It's like, well, it's this is all a bunch of plants. And she just amazed. She said, nobody's hormones are this normal
Mm.
after all the things. I even had during my C-section, they took my tubes just to test and make sure there was no cancer spread and things. And you would think that would cause, an upset in my hormonal balance, and nothing, no issues, no nothing. So it's just that's what this is about, is just being able to help women regain that balance. We're all crazy because we're all these endocrine disruptors have messed us up all these years. These periods that they're
Everywhere.
having
Hmm.
are awful. We get the stories all the time about how unbalanced they are, and then they start to use the drops and it brings balance to their systems. It's just, to me, it literally just brings us to tears. And my sister's actually more of the hormone guru. She's read all the hormone books because she had more of an issue with her hormones. And I mean, it's, to me, just watching it play out, it's just amazing. Like, I couldn't have even predicted that when we launched them, I just wanted to help people, feel more balanced. I never knew it was gonna, like, I mean, you've got people with cysts just disappearing on their ovaries, and I mean, just crazy stuff. Thyroid, nodules going away, just keeping their thyroid healthy. We have thyroid drops. I mean, it's just crazy the testimonies we get.
It's really interesting because most people think when you talk about hormonal imbalances that you're going to need some kind of progesterone cream or something very kind
Right,
of, invasive almost. If you're doing some kind of pellet therapy, of course, you have to cut in,
right.
place that in. It has to, it
Mm,
is,
intimidating.
pretty, yeah, yeah.
Yeah.
And it reminds me, I actually had a guest on before that was saying, and she was very into essential oils, and she was in her late 30s, early 40s or so, and said every time she goes through OBGYN, it's like it's amazing. Her hormonal levels, her reproductive system
Mhm.
just
That's
and they
awesome.
don't know why, right? Because most people they're putting on hormones at this age and have
Right.
hormonal imbalance. So to anyone listening, this is somewhere to start if you have, and so
Absolutely.
many people to look into the drops from Rowe Casa and the essential oils in general as a starting
Yes.
place. And I think that's the big thing here is people need to realize we don't need to jump into the kind of
Right.
biggest or pharmaceutical drugs or anything.
Mhm.
Not saying that's not necessary. Like
Right.
you said,
Right.
that's absolutely necessary for some, but
Mhm.
why wouldn't you start somewhere with less side effects, less reliance, less any work your
Absolutely.
way up? If that doesn't work after a few months, move on.
Yes,
So
yes, that's a great point. We always talk about how the problem is our first line of defense has been a pharmaceutical drug that does not treat the symptom and then causes more issues later.
sure.
And so it's like, why not scale it back, bring it back to nature, let that be your first line of defense. Obviously, if you're miserable and nothing's working, go get your other medical advice.
Yeah.
And I'm not saying there's not a place for that, but I talked to a functional medicine doctor not too long ago, and she said, I'm willing to prescribe medication to my patients. I just very rarely have to because
Yeah.
we're dealing with the symptoms. And I mean, the roots and not just the symptoms. The symptoms are just a sign of, hey, we need to figure out what the root is. Are you stressed? What's your job like? Are you eating poorly? I mean,
Mhm.
she digs in and gets to the root, which is that's what my doctors do that are overseeing me post cancer is, hey, we're going to look at your labs. We're going to see if there are any roots brewing in there that we need to get with and help. And so, symptoms are just a symptom, just that, just
Sure.
showing us something's gone wrong. And so many just want to go treat that symptom, and that's their first line of defense. And we have not given nature a chance to work.
No.
So
And
that's
we
a
we
big
haven't
time.
asked that question why. Why do you have that symptom? No one seems to care in at least the
Right.
conventional worlds.
Mhm.
It's just you
Mhm.
have that symptom, who knows? It's genetic, right? That's what we
Oh
usually
yeah.
throw out. And
Yeah.
here is something to treat that symptom, to subdue it,
Right.
to sweep it under the rug and push it down. But the why
Yes.
is never addressed. That's why
And that,
yeah,
yes.
when we
Mhm.
approach it also in that functional, integrative, holistic manner at our clinic, it is we want to know the why. We don't even care so much about the symptom because it will resolve itself when we get to the why. That is the
Exactly.
root, the underlying. And guess what? You can do that in such a natural way, normally,
Mhm.
without having to turn to invasive procedures or pharmacology.
Yes,
So,
yes. That's something that for me going through cancer, the conventional doctors will look you square in the face and say, it was nothing you did. It was
Mm,
nothing you did that
mm,
caused your cancer. Do you want to know? Okay, is that supposed to make me feel better? Because it's very defeating.
yeah,
Because if I can't fix it, then I have no control over it. And
absolutely.
that's not okay with me. So that did not sit well with me. But that's what they did. They would look straight at you and say, it was nothing you did. I mean, okay. I feel like it was.
Yeah.
I'd had 35 years of eating like crap, and I've had some things done do, and that was not something I was willing to accept. And
Yeah.
so I got all the cancer books. I got the Chris Beat Cancer and the
Mm.
all the books. And I started reading up, and I was like, this is absolutely something I did. And it's something I can fix and something I can do. I can do something about this. And I'm
That's
ready.
yeah, that's where people sometimes get it wrong, that if you're saying it is something that you're putting blame or that you should be guilty.
No,
No, never see it as that.
no, it's
Because if you could
empowering.
take responsibility, it is empowering, right? You have now the
Yes.
power to get out of it if you got
Right.
into it. If someone's
Yes,
telling you nothing you did,
absolutely.
you'd always be here, it all
That felt
then that's
hopeless.
terrible. That's all right.
Yes.
I have nothing to lean on but this person,
Right.
and they're telling me this is my only option.
Right, and
Surgery,
it felt
drugs, chemo,
hopeless.
right?
It could
Yeah.
come back at any time, and I have 0 control over it. I beg to differ. I
Yeah.
beg to differ,
Oh, it's wonderful that
and
you could push
yeah.
back, because many people just say,
Mhm.
"Okay, that's it, nothing to
Exactly,
do,"
that's so sad.
and
That's a
just
hopeless
dejected.
way.
Yeah,
Mhm.
yeah,
That's
no.
a hard way to live. Yeah, I wasn't okay with that.
Well, speaking of hope, talk about the charity aspect of Rowe Casa that you do and how you give back to the community and give some of that hope to the community.
We love to give. We believe that as a company, if God has placed his favor and he's using us, that we are blessed to be a blessing. And
Mm.
so that is just kind of what we do. We got the opportunity, and I tell people all the time, I don't even like talking about it. I would prefer just to give in secret.
Yeah,
I don't
yeah.
like to appear like I'm bragging or anything like that. But it is such a blessing to be able to help those in our community, those locally. Just we rarely turn anyone down if they need a donation or a gift basket or whatever. We love doing stuff like that. But we did get the opportunity of building an orphanage in India last year. So that was kind of our Row Casa Gives Back mission last year. And we were able to house 50 children with teachers, clothes, food. They were on the streets. And it was just an amazing thing. And even despite the COVID, we thought, oh my gosh, is this
Mm.
going to work out? It was delayed. We didn't get to finish it till like February instead of December, like we were hoping, but they did. They were still able to accomplish that. And we got all the videos and saw the kids' faces. It was a beautiful thing to get to be a part of. So we
So
try to keep
rewarding.
that in front of us. The mission is to help as many people as we can in all the ways that we can.
Amazing, amazing. You're able to do that and help others, and then do it in such a way that can influence so many lives. Those 50 people are
Absolutely.
forever changed. So that's
Yes.
amazing. Now, let me ask you this: what's your personal favorite Rocasa product? Put you on the spot. Only one. You
Oh
can't
my
say all of them.
goodness. Okay. I mean, I really honestly have to say the elderberry. It is where
Mm,
it started and
it's
it
where it started.
continues. I mean,
It's
like
your baby.
we're in the middle of allergy season too. And like I said, I see everybody sniffing and snorting and snotting all over the place, but I have my elderberry. So I just feel that it is still my go-to. I take it every day and I think it's got to be my favorite. That's hard to choose, but that
I
one's a
mean,
good one.
that's where it all started. So of course it has a significance to you. So that's a
Mhm.
good answer there. Jill, what's
Very
next
true.
for Rocasa? What are you excited about?
Oh my goodness. We don't know. We never know till
Mm,
it happens. But we believe that this year is going to be a year where we're able to penetrate into the nation on a whole lot larger scale than we've been able to do so far. We believe that the opportunity is going to come to where we can reach so many more people. We just launched an affiliate program, not an MLM, anything like that. It's just people who will work for us that we can reach more people, that we can help them reach their spheres of influence and help train them on the products and the knowledge behind it and help get these products into more. There's still so many people out there hurting, looking for a better way, and we just wanted to find a way to do that. So we've got that coming. We just now were able to pick those and so we're getting that program going. We also hired someone to begin to try to get into some of our bigger stores like the Targets, the Walgreens, the CVS's. So we've got that on the horizon. We're hoping and praying for some kind of breakthrough there. We just had our first conventional healthcare clinic get behind us as of yesterday. They've begun to sell Rowe Casa in their healthcare clinic, which is huge. We love being able to link arms with the medical community. So, those are all things that moving forward, we hope to be able to do more of. So, we shall see.
Awesome. And congrats on that because I really do think once you have that
Thank
in the
you.
medical establishment, it really helps with the validity of it and it helps get it out and it helps,
Yes.
get in people's minds that, okay, this really does work if my doctor told me.
Right.
So
Yes. That's exciting.
yeah, no, really exciting stuff. And by the way, my favorite product so far, elderberry's great. Your mouthwash is fantastic. I,
Oh,
I
I'm glad
use
you
that.
love it. That one's a hidden gem.
It is,
It really is.
and here's the thing, I spoke not too long ago with Dr. Dominique Nischwitz, who's a European biological dentist out of
Oh,
Germany. He wrote a
neat.
book, All in Your Mouth, and he talked about how most of the mouthwash he does not recommend at all. It's
Yeah.
antiseptic, and you have so many good germs in your mouth, you have to feed them, not kill them. And that's
Right.
really the initiation point of so many dental issues and issues of the body altogether
Right.
is that
Yes.
microbiome in your mouth. And I look at what's
Oh,
in
yeah. It's
your
awesome.
mouthwash and it tastes so good. And I almost do a version of oil pulling with it because it just
Yes.
you just leave it in there and it tastes
Yes.
wonderful. So for
Yes.
anyone listening looking for a
Awesome. Thank
good
you.
mouthwash that's natural, that is good for the microbiome of your mouth, go with it.
Wonderful. Thank you. That's not talked about a lot, but I'm glad that you noticed because
I
we love it too. That's
love it.
awesome.
It's the little
Awesome.
things for me, right? The
Yes.
mouthwashes of the
Yes.
world.
Right. Exactly.
Where can people learn more about Rowe Casa, purchase it, get involved?
Well, we have a really strong Facebook group. So I started a Facebook page when all of this, and I realized it was actually going to be a business. It looked like I was like, okay, well, let's do. I was all about Facebook, so it all started. So we have a Facebook page, just Row Cost Organics. Our VIP page is rocking and rolling. There's almost, I think, 40 to 50,000 between the two groups. So we've got around that many followers right now, which is amazing in 2 years. So people just love to share their testimonies on these products. So our Facebook, Row Cost Organics VIP is what it's called. They can join there and be able to see lots of people's testimonies daily. We're getting testimonies posted, and it's so fun to see people get so excited.
Mhm.
So that group is hopping over there. And I stay very involved over there. My whole team, we have an entire customer service team that's there to answer people's questions about the product. So if you have any questions, you could just post in that group and they're right there waiting to answer you. So we really highly um, value customer service. So we want all of our customers to feel very loved and valued. And so when they have a question, it gets answered. And sometimes it's a very detailed question, but we do our very best to guide them with natural products. So a very knowledgeable team is behind us. So I'm thankful for that. So VIP Row Casa is available. There's also an Instagram account. It's at underscore, I would say it's row underscore casa underscore organics.
Mhm.
So that's Instagram. My sister's very involved with that. Again, she has a whole nother set of skills and knowledge that she offers over there. And like, she keeps things pretty. I'm the homegrown crowd. We keep the homegrown crowd happy. She keeps the pretty crowd happy over there on Instagram. But we have a lot of fun tag team in the social media, but that's where you can find us.
Amazing. I hope people head over there and do use your products. I'm really excited to see what's next and
Thank
wishing you and the
you.
Rowe Casa family continued success. Thank you so
Thank
much for being on the
you.
show.
Thank you so much.